I'm so happy to welcome Dr. Brom here today. He's the co-founder of Natural Medicine magazine. We started this magazine together in the year 2000. Welcome, Bernard.
Thank you.
You've been a medical practitioner all your life and suddenly you changed direction. How did that happen?
Well, I started off specializing in gastroenterology after I qualified in 1965. And I then ended up in America. And I thought in America you can live your dream, get the best job, live well. And it turned out to be exactly true. It took me about 8 months to live my dream and realized that having lived my dream, I was still unhappy.
Right.
And even medicine wasn't working out for me. I was specializing in gastroenterology. I had a big laboratory. I was traveling around America, and yet I was still unhappy. And I don't want to blame only medicine for that. I was unhappy with my life as well. And so one day, as a result of a whole bunch of consequences, I suddenly decided to give up medicine and walked out of my practice, told my boss that I was giving up medicine, and became an artist.
Oh my goodness.
Yeah. So that worked for about 9 months, and I suddenly realized that I wasn't making money in America, and somebody suggested I should go to Europe. And so I bought a Volkswagen Combi and picked it up in Luxembourg and traveled around Europe for a couple of years, and then went to Sri Lanka and then to India, found a guru, and that shifted a lot of things for me, because I realized that my unhappiness had nothing to do with the person I was with or the country that I was living in. It had to do with me.
Right.
And so the focus of attention shifted from seeking outwardly for my happiness to turning inwardly.
You've always been quite spiritual.
Yeah, so I've always been interested in things of more spiritual things, more mind things, more how to use the mind to affect the body. Eventually, I came back to South Africa in 1977, I think. And I suddenly realized that I really needed to make a living, that I couldn't work as a hippie, and I couldn't work as a farmer, and I couldn't work, I was trained to be a doctor, so I decided to start back into medicine.
I don't think a hippie doctor would have been, would have definitely been
at
frowned
that time
upon at that time.
Yeah, it wouldn't have worked very well. So, and when I started in medicine, I'd been out of medicine now for about almost 6-7 years. And so I started to read my books again, right, to read up about the use of drugs.
Right.
And I suddenly saw, whoops, these drugs are quite dangerous. They got side effects.
Mm.
And having been living a much more cleaner life for 6-7 years, eating organic food, doing meditation, the thought of giving people drugs that had major side effects started to bother me. And so I started to study things that were more natural. And at the time, it was interesting for me, because at the time, one of my early patients was a nursing sister who was working with a naturopath in Cape Town, a very famous naturopath.
Mm-hmm.
And she gave me his cleansing diet. Now, in my mind, that cleansing diet was very simple. It's a long time ago, so I'm not even sure that what I tell people is 100% true. But it was a very simple diet. Mm-hmm. And I think it consisted mainly of boiled potatoes and onions.
Right.
And my first patients were all colored workers on the farms that were living in the area that I was practicing in. And they all were coming to me. And all I did at the time was say, whoops, I don't want to get drugs, but I've got this diet. So I'm going to tell them to do this potato diet and onion diet.
Right.
And I was astonished at what was happening. They were all coming back to me after a month telling me that they were feeling so much better. And of course I realized after a while that part of the reason was that I'd stopped them eating their junk food.
Okay.
They were no longer eating all their junk food, they were just eating potatoes and onions and a few odd vegetables. And they were turning around from serious illnesses, asthmas and other chronic diseases, and feeling so much better. Blood pressure was falling down, Diabetes was improving.
This must have really inspired you to look
this-
further and
yeah.
do some more research on what other practitioners are doing and how they are looking at complementary medicine and integrating that into an allopathic practice.
Well, it wasn't quite like that because I was a bit of an island in an area. I'd come back from South Africa after 7 years. I didn't know doctors. All the doctors in Stellenbosch where I was practicing were very, very conventional doctors. So I felt very much alone up
Were
there.
you targeted at all?
Well, that was interesting. I never did because I kept pretty quiet to
Okay.
start off with, and I was being very. And I wasn't in the early days. I still occasionally used some antibiotics, not very much. I used homeopathic medicines, and my patients didn't care as long as it looked like a medicine.
Right,
You know, and I was giving them green pills and blue pills and whatever the pills were. They were all homeopathic medications, so they thought they were getting medicines, and they were happy about that. So they never asked too many questions. And very soon I learned. I did some courses in acupuncture, did some more formal training in homeopathy. So slowly, I decided at some point that I wanted to become a non-drug doctor.
right.
What would it be like? Is it possible to actually practice medicine without using much drugs? And I got more and more into diets, lifestyle management, the use of herbal medicines to treat illness, and acupuncture in particular was astonishing to me. I mean, I couldn't believe it that putting in needles into people's body, pain would disappear. I also became an expert in the use of low energy lasers. In fact, the first 2 years of my acupuncture practice, I never used a needle, I only used laser. Because you can use the laser, which is a light.
So you're not breaking the skin and you're not having people with fear of needles. So with the low energy laser, you wouldn't need to stick needles into people.
Yeah, that was the nice thing, because even though I was a medical doctor still, when it comes to using acupuncture needles, there's still a little bit of hesitance around it. So because I had a laser, I was able to use a laser to stimulate acupuncture points instead of needles. So I could use it on children, on babies.
Wonderful.
So for 2 years, I never touched a needle, actually.
It must have been effective. I mean, you would have continued using this if you didn't see the results.
It was amazing. I mean, I couldn't believe it as a medical doctor that this was such a low energy laser. This is low energy lasers, 1 milliwatt, 2 milliwatts, very low energy. And yet I was seeing miracles. I mean, if I was doing 5 or 6 laser treatments a day, I saw at least one miracle every day. Somebody with shoulder pain that was gone after one treatment.
My goodness, but you couldn't keep quiet. You had to stick your hand up and say, and I think you, around the time, it was about 1995, you published the first complementary medicine journal.
Was it then?
I think it was then, yes.
Okay.
Yes, I came in at the second
Yes.
complementary medicine journal and we started working together then.
Yes.
And I remember doctors were very slow to come round. It must have been quite a very difficult situation that they were in, because how do you suddenly start using homeopathy and stop giving people drugs? Most medical practitioners would lose their patients.
Yes. So, I mean, that was an interesting time, because it was around about that time that the journal was, I mean, part of the reason why the journal was started was just before then, a group of doctors came together to form what is called the South African SACMA Complementary Medical Association. And those were the first few doctors that had ventured into this, you could call it, we called ourselves at the beginning alternative medicine.
You were such a pioneer. You really led that group of doctors. I remember the conferences we used to go to, and we pulled 300, 500 people, and just those conversations, and there was a camaraderie and excitement around medicine in South Africa.
But it was interesting, because in the early days, most medical doctors that were journeying into this so-called alternative medicine were practicing either acupuncture, homeopathy, Ayurvedic medicine, anthroposophical medicine. So they were kind of medical doctors and homeopaths, medical doctors and acupuncturists. So there was this kind of distinction in that kind of way, which slowly started to shift for me personally, because I had not called myself a homeopath or an acupuncturist. I called myself a medical doctor using a lot of complementary medicines. And so I said come to the meetings of SACMA and said, look guys, we need to change the name, because actually medical doctors are now expanding into a paradigm, expanding the paradigm of medicine to include lifestyle management and how to support health. And we should change our name to integrative medicine.
Right. Because you're not alternative to
not alternative,
conventional medicine. You are integrating complementary medicine modalities, therapies into an allopathic practice and use both of them. So you had a group of doctors interested to look at both sides and then called yourself integrative medical practitioners. Is that when SASM was formed?
Well, what happened was, you see, even the word complementary, alternative, we realized was a really bad word for medical doctors to be using, because we were still treating people. Complementary, the whole concept of complementary was because we were using natural medicines to complement our practice of medicine.
Right.
And it suddenly occurred to me one day that actually I wasn't doing that, because I'd stopped using drugs. That I was using natural medicines to complement what the body was doing to heal itself. So that we were now, the whole concept had shifted now, because we weren't just complementing our practice of medicine, we were complementing the body's natural healing capacity.
Wonderful.
We were complementing our practice of medicine. And I was saying, hang on, what needs to happen here is we're actually complementing the body's natural healing capacity, and that's
it's not about your practice, it's about your patient.
It's about the patient. And also it fits in a way to the conventional model, because conventional model treats disease and we were supporting health. So that's how the whole concept of integrative medicine came about, that we were integrating the conventional practice of medicine, lifestyle medicine, and supporting health medicine. So that's what I call the three arms of integrative medicine. Is the conventional medicine, which doctors are trained in. They know how to make a diagnosis of disease and how to treat disease with drugs. At the same time, they are specialists in lifestyle management medicine and how to support health medicine. Because the only thing that can heal your health is the body's health. Only health can heal. Drugs don't heal, and even natural medicines don't heal. They are supporting the body's ability to heal itself.
It's just another pill for an ill philosophy if you grab a natural product and you use it with the intention that it needs to work like a drug, which it does not.
Which it doesn't do. And that's the big mistake that everybody makes, is that doctors who use natural medicine are using them instead of drugs. No, they're not. They're using natural medicines to support health. They're using drugs to treat disease. And they will use both if it's appropriate.
Right.
But when a patient comes in, it depends in a way what the patient wants. If the patient wants more health, then they're going to have to look at lifestyle. Because drugs don't give them more health. Drugs treat disease.
Tell me about your specialists. Who do you have? This is so exciting.
So we have Dr. Daleen, who's an integrative oncologist in America. She's also a specialist in treating addictions.
Would she use chemotherapy and integrate that treatment protocol with complementary medicine? Or why would you call her an integrative oncologist?
I think that all integrative doctors, medical doctors around the world, use a mixture of natural medicines, lifestyle management, and drugs as appropriate.
Right.
So an integrative oncologist would probably use chemotherapy in maybe lower doses than they would normally use, may even use radiotherapy, but they understand about supporting health.
They will obviously have the information and the knowledge and experience to use the correct natural products to support the body that doesn't contradict the drug therapy.
Yeah, so they would have staff. They would have a big staff who would help the patient through food choices, exercise programs, because in the end, to be quite honest, lifestyle changes are much more important than any natural product or any drug.
Right.
By far, if you want to support health, You really, really have to start at the basic building blocks.
But if a person is sick and they're tired and they have cancer and they're at stage 4 and they've been on chemo and the liver is taxed and they're toxic, how would a lifestyle management program turn it around for them? Are you talking extra water, more sleep, exercise, and how would they go about? What would the program look like in a nutshell?
Yeah, every integrative oncologist will handle it a little bit different, but all of them will still nevertheless put a patient on fruit juices.
Right.
Something easy for the body to digest. Might even do intravenous nutrients,
right.
Amino acids, magnesium, all kinds of intravenous, vitamin C. So they would use all those nutritional support that the body would need to
fight,
to deal with the cancer. Yeah. So, and I think also I'm quite big on mind-body stuff.
So diet is one part of lifestyle management, and then it's the mind-body-soul.
Mind-body-soul. Yeah, and people just don't get it that the mind can influence the body. I mean, my hand goes up because of thought. Thought which can't be measured, which is not powerful, but it can. My body responds immediately, even though I don't even know how to do it. I have no idea how this whole mechanism works. So thought is enormously powerful, and so it's very important to change the story that people have, because people with cancer have a story that is not supportive to health.
Right.
It's very destructive. It's a lot of fear-based. And they have to shift the story, So all that is part of a proper, holistic, integrative cancer management is exercise, even if they're weak, just to get to move their lungs, to do a massaging of them if they can't move.
So touch therapy, body
music
work,
therapy,
music, art, light, all of those beautiful modalities.
And that's what's done in all integrative oncology centers around the world.
Wish we can have more of that in South Africa, and I think having these speakers out here might really inspire some medical professionals to relook at their practices and talk amongst each other and maybe join forces and have a cancer center where they can complement and bring other practitioners on board and do this properly. We're all about encouraging people to take their power back. Natural medicine is a vehicle to educate and inspire, and I think that is one aspect. But if you're a cancer patient, you can't self-treat. You need to understand about drug-herb interaction and about the toxicity of the body and about cleaning the body, right? So you need guidance. You need a professional.
And when we know so little, in a way, about how cancer starts, how it develops. But the body has the intelligence. The only reason why people don't get cancers when they're very, very young, often, is because the body has anti-cancer mechanisms, major anti-cancer mechanisms.
I've heard we all have cancer cells all the time. They're just not switched on.
Yeah. So we all have all kinds of so-called diseases starting up, and the body's dealing with it all the time. That's what the body does. The body has very powerful healing mechanisms. And those healing mechanisms are there. It's only when those healing mechanisms start to go downhill that illness can start to come up. But if you can increase the healing potential of the body, then the disease goes down again. So it's not anything unusual to think about. I mean, the more health, the less ill health. So if a person's got ill health, then support health.
That's a nice bumper sticker.
Yeah.
More health, the less ill health.
It's true. Yeah.
So lovely to see you again, Bernard. Thank you for your time. Appreciate it. And all the best with your conference. I'm sure it will be packed, and we'll learn a lot, and we will be there, and we'll film and interview some experts. So please tune into our channel.